We actually use business intelligence tools to try to tackle the issue. So you start off with access points. And in an organization like ours, there are many access points for a patient to enter into our healthcare system. So if a woman has a breast mass, there's many different locations where she might receive a mammogram or an MRI, depending on the initial imaging procedure. And then there's many different locations where that individual might receive a biopsy. And so that's what you start with. You start with what are the access points. And then once you do that, you look at all the different steps that have to go into what happens after that to the initial treatment. And so sometimes patients need cardiac clearance. As an example, patients with lung cancer almost universally need to see a cardiologist to make sure that they're fit and can in fact have a surgical procedure in their chest. The list is over 100 different things that go into what happens from point A to point B. And so we have to address all of them one by one by one, brick by brick, to see what we can do to become more efficient and how to coordinate care better. Care coordination is essential. And that's what we're doing. There's a lot of solutions. But the first step is to acknowledge that it's important, to make it a priority, and to have everybody in the same room talking to everybody.